Next up, we have a powerhouse. She is called Ifeoma. She comes from the University of Nigeria. She is a keen advocate of early detection. In fact, Ifeoma, on the back of her jacket, I just noticed it actually when you went to the bathroom earlier. She actually has a jacket advocating for early detection. Her nickname is Pinky Prof because of all of the work that she does in breast cancer, and she is sharing best practice. She is a big advocate for all of the innovation in Nigeria, and she will blow us away, I'm sure, with everything she has to say. Ifeoma, big round of applause. Looking forward to hearing all about you.
Thank you very much. Good morning, everybody. I'm so excited to be here. And I really want to tell Peter and Ilona that I appreciate the opportunity that they've given me this absolutely amazing platform to present some of the work we have been doing, especially to express our passion for early detection. Indeed, I've been a medical practitioner for 44 years. And in those 44 years, I've been intervening to break the vicious cycle of fear of death from cancer, because that is the narrative. The narrative that once you have a cancer diagnosis, the next thing is death. Indeed, that perception is so deep that you find people actually coming to pay you a condolence visit once they hear that you have a diagnosis of cancer. You come to somebody's house and everybody is sitting like this. And so the person is alive but expecting death any day. And when I counsel patients, I say to them, and sometimes that has happened, you have 3 years to live, but they live for 15 years. And can you imagine the agony of waking up every day and expecting death? So I'll say to them, take your mind off this diagnosis and begin to live, because everybody is going to the same place. We're all going to die. How many people have come to visit you with this solemn face to condole with you, who you have stayed alive and have had to attend their burials, and they didn't die from cancer? I think that used to help to jolt people out of that aspect, but it needs to be done on a broader aspect, because everybody has, the narrative has to change. As a medical student, I encountered this disease so different from other diseases. And that difference was the mindset and perception of the healthcare providers. What was that mindset? Once there is that diagnosis, unlike other diseases where they tell you about how to manage it, what to do and all that, they actually ask the patient to, remember I'm talking about 44 years ago, they ask the patient to invite their close relations, and in that counseling session, what they advise them is that they should, prepare to take the patient back home. There was no palliative measure, even though they come late. take them back home so that they can put their house in order. More or less, that is serving you a death sentence. And I said to myself, what kind of disease is this? And it became an enigma to me, and I started searching. And I found out that Medical Women Association of Nigeria were actually intervening in communities and trying to get people to come and screen so that we can have early detection. So the driver was actually late detection. So I'm going to speak to us today about running a successful cancer advocacy group targeted to end the reign of late cancer detection. And it's the Nigerian experience, which is actually personal to me. And I am a believer that we are actually born not for ourselves, but in order to impact others, to look beyond yourself and what is your problem, and look around your sphere of influence and see how you as an individual can make a contribution. And I believe that no matter how little that contribution is, it is still an important contribution that can actually make an impact that you may never have envisaged. So that's why I have here this little by little. This is talking in like what we call pidgin English. Little by little, a little becomes a lot. Now, if I go the English way, that same proverb, which is an African proverb, will read, little drops of water to make an ocean. So as we sit here today and we are reflecting on the silent despair, let's be asking ourselves, in this scenario, how can I, as an individual, make a contribution? Whatever comes to your mind, because we are all given a gift, and we can use that gift in making that significant contribution. And even though you may think it is small, you may be surprised many years later to look back and you'll be seeing the great milestones that you've been able to achieve. And this is going to be like the kind of story I'm trying to pass on today. Early detection, it saves life. So I was painting a scenario where the fact that people die shortly after diagnosis is simply because they come late. That's what I found out. And that was what was driving this whole essence, even the attitude of the healthcare providers. Because at the stage when the patients come, they come when the available medical solutions are unable to truly assist. So if we can do something about cutting this vicious cycle and increasing the number of survivors that can share their stories, just as Inspired to Live has motivated several champions across the world to gather annually and to be part of an organization that is able to encourage, to inspire, and to ensure that that assistance is made available to help you move the next step forward. And so if we have enough survivors in Nigeria, for instance, if you call out for a walk in the US, you have millions of survivors of breast cancer alone that will come out. I think Common is one example of such a walk in America. But we don't have survivors enough to share their stories. And those that are available are afraid of stigmatization, so they don't come out. I would say they're silent, as it were. And so they're not sharing their stories. But when we have enough survivors, they will pull together. So what we are beginning to see in the last 5 years is an aggregation of those who have tenaciously survived. And this year, for the first time, they're having a convention in Lagos, just putting themselves together as a group to speak with one voice. And I believe that that's going to have a huge impact. And so the role of cancer advocacy groups is to play a vital role in raising awareness, providing support, and influencing policy related to cancer care. And the question is, how have we been able to do that? We've done that significantly through fostering partnerships. And that's why I am here today. And Dr. Obalo is here today, Benjamin. And quite a number of us are here to partner with Inspire to Live, to see how we can take their solution for early detection and make sure that it is rolled out in the over 200 population of Nigerians, so that we'll be able to achieve this huge impact we are talking about. So what have we been doing prior to now? This is the NGO with which I started this journey. It's called Breast Without Spot. And the slogan we have is making late cancer detection history. We want to make it history. We want to break the neck of late detection, because that is a driver for late cancer, for the high mortality and morbidity. So what have we been doing? We have an organizational structure. We have community engagement. We engage with the community. We engage with government. And we also fundraise. The fundraising is not in the dimension of what we see globally. We fundraise from amongst our friends and relations. And that is what has been sustaining our work. So that's the Board of Trustees. And I want to give us a breaking news. An Airbus A380 carrying 600 passengers just crashed, with all 600 passengers feared dead. This is the news that can chill the bones. But do you know that this is what is actually happening? We have 14,700 deaths occurring in Nigeria every year from breast cancer alone, which actually translates to 40 women dying daily from breast cancer, and which further means that 24 to 25 plane loads crash annually, which further means that there is one plane crash every 15 days. What a statistics. It's truly awesome. What a pity. This visualization, I try to use it so that it can make people know that this is not the time to fold our hands and do nothing. It's a time, it's crucial, it's a time for action. So what is one of the things that drive this late detection is what we call, it's not my portion. Everybody thinks it cannot happen to me. And why is that? Because they think it's diabolical. They have superstitious beliefs about it. They then think it's a disease. So there is gross unawareness, which we have to break the cycle, and which we've been trying to do. But because there are not enough survivors, the fear continues to drive that vicious cycle. There are quite a number of things. There is screening hesitancy because of that fear. They don't want to find out. They don't want to know. And therefore, we need to find ways to push this information to them in order for them to find out. And I had this abstract in Chicago, and there you see the many ways in which we have tried to reach the people. We've tried to use creating an army of advocates. We've tried to use ready-made crowds. wherever women are gathered, wherever men are gathered, wherever they are gathered together, we try to reach them in the marketplaces, in the faith-based organizations. We reach them there. So we take the message to the people. And what else do? We try to take the service to the people, because a lot of people are paying out of pocket. So when you talk about screening and you're targeting a well population, it's a hard sell. They don't want to utilize the little funds they have to feed themselves in order to go take a transport to access the service of screening. And furthermore, they don't want to pay for it. So if it were even free, that would be even much better. So we mobilize the community of people who can afford it to give us funds, and we take both the message and the service to the people. And when we do that, Nigeria has a cancer health fund that is assisting in the tertiary hospitals to give free treatment, subsidized treatment to the patients. So we're tired of talking, and we decided to instigate all these mass action, awareness, improve screening, treatment, and diagnosis. And how did we do that? We tried. I've just been given that I have a lot of time, as it were. So I'm going to have to truly run. So we partnered with global partners like UICC, and now with Inspire to Live. We partnered with research organizations, especially in the US. So we are doing a lot of research. We are doing a lot of creation of AI tools to enable better diagnosis. And why are we doing that? The AI tools are already being created to improve on detection through screening, mammography, interpretation. But our patient population, our images are not included. So what we are trying to do with Stanford, for instance, is to work to include the images from our patient population, so that we'll ensure that when we are utilizing the AI solutions, we are actually utilizing something that will work for our own population. And we are also doing a lot of effort to collaborate for multi-center studies. We have with Mayo Clinic, we have with MD Anderson, and we have with quite a lot of institutions looking at breast cancer subtypes and all that, in order to improve on the participation of our patient population in the clinical trial process. So I just want to now show us images. As I said, we have partnered with government, and this is level of advocacy across board, creating cancer control plans for 5 years, creating an international cancer week, which is actually starting today in Nigeria. It started in 2009. It's an annual event. It gathers every stakeholder. And creating the Cancer Health Fund that is assisting patients to pay their bill. So this is the Stanford collaboration, creating the AI tools, and the African Clinical Trial Consortium that gave a solution of creating clinical trial units as a way to make sure that the data that is coming out from our sites is reliable. I head this center, the University of Nigeria Center of Excellence for Clinical Trials. And we use that to reach out to do translational research, training, and discoveries. So the following slogan, making late detection of cancers history, BWS set up the following initiatives to address this knowledge, attitude, and gaps, knowledge, attitude, and practices, and to close the care gap. And what did we do? We were able to set up the NGO. We're able to, in Nigeria, we have a set of tertiary education graduates that have to give a 1-year mandatory service to the country. So in 2009, we assessed this existing infrastructure that is capable of reaching the 774 local governments, which Nigeria is broken up into. It's a huge population. And to reach that huge population, we needed to instigate the power of one, where we are reaching people one-on-one, and to break that attitude of, it's not my portion. So this NYSC have created a community development service where they go into those 774 local governments with the information we have given them through a training manual that we created. So there are cancer prevention advocates, there are food soldiers for change created in 2009, still existing today. And we also have the BWS National Medical Screening Squad, the ones that take both the message and the service to the people. Then we have the annual International Cancer Week, which I said started today, but has been in existence since 2009. Then we have the annual Youth Jamboree. You know, you need to catch them young, because it takes lifestyle modifications to going through a number of years to be able to really use your lifestyle to modulate the cancer. So what do? We get them into a platform on an annual basis where we do trivia that they love, like have musicians, celebrities, and whilst they're enjoying themselves, we talk to them about lifestyle modifications needed to reduce your risk to people. So we have Operation Read Nigeria of late detection of cancer, one state at a time. Nigeria has 36 states and the Federal Capital Territory, making it almost like 37 states. So we also have the Nationwide World Pink Day, which is why I'm in this outfit. In October, we stimulate and get everybody really, and we have 70% of our population on social media. So what do? We engage them in this trivia, and whilst everybody is having fun, going gaga pink, just like I'm doing with the late detection message. And also, this is just one message, all sorts of messages, all sorts of messaging. You know, I'm a professor of medicine for 19 years. And if I can go in this ridiculous outfit, it really draws attention. And I do that, I put myself on social media and I get as many, noteworthy individuals to do the same, and organizations. And now the Federal Ministry of Health has taken it up, and this year they mandated all teaching hospitals to make sure that they go pink. So that's one way of creating trivia and attracting attention and getting the kind of hysteria which we were able to use to battle Ebola down, to battle COVID down, and enable people to see beyond the disease and begin to see themselves as part of taking action that will lead everybody to where we want them to be, and that is reduce downstage our tumors, save more lives, have more survivors sharing their story. So I'll just end up with a lot of pictures. I've talked about ready-made crowd, using faith-based organizations. Christianity, Muslim religion is very big in Nigeria. So on Sundays like this, everybody gather. And for different reasons, they gather at different times. So when they gather, we go there and we utilize that existing crowd that has already been gathered without our resources, and we pass on the message. That is ready-made crowd. I also have a women health army. We screen the women, we put them on the WhatsApp group, and we utilize them as gatekeepers. They will create gateways into their communities for us to reach their community. Because is there resistance? Yes. We've had funding for HPV vaccination, and people actually refuse to be vaccinated. So you need gatekeepers who know what you're talking about. So we have publications, we have some grants which we have used. So these are some of the activities taking works. This is the First Lady of Nigeria at this time. I'm rounding up. At this time, at that particular time in 2009. And these are the NYSC, National Youth Corps Service, the cancer advocates. You can see them. They go into the communities. They're trivializing things. They're making fun of doing breast examination right there inside the streets of the different rural communities. So that's the training manual. Cancer kills, get tested. These are some of the actions that we've been taking in these regards. So they've even set up cancer clubs in secondary schools. I don't know what is the equivalent here, before the university, that level. So catching them young goes beyond there. And those are the members of the secondary school cancer clubs. Secondary school cancer clubs, this is the Women Health Army. A lot of activities trying to attract attention, and ideas without action cannot propel you forward. So we have instigated all these actions to propel us forward, going pink and reaching all sorts of people, non-governmental organization, the Nigerian population, outside community, and also trying to work with the African community so that we'll forge a united front to be able to battle this. So more actions. So you see the pink boot, the pink beret, and the pink gloves. We are trying to crush cancer. It seems as if we are making fun, but as people are attracted by the fun, we start passing the message. We start instigating people to offer free screening. And that is all of October. It's really, really very interesting. A lot of screening, but it's not only an October thing. It's all year round. We find ways to sustain this awareness, give information, in all different ways. Talk about lifestyle modifications that you need to implement in order to reduce your risk to cancer. So we talk about nutrition, talk about exercise, we talk about obesity. I mean, it's non-stop effort the whole year round. And that's it. Thank you very much.
Thank you so much. And I'm happy that we know also why you are named the Pinky Professor. We're running a little bit behind, but I don't want to take away the opportunity for at least one person to respond or ask a question. So who wants to go?
Can you tell us a little bit more about what you do in the secondary school? Because I really relate to the fact that we need to take the message to the youth.
Okay. For the secondary schools, I hope you understand secondary schools, because I know the terminology is different in different countries. So before your university, so what do? There are secondary schools littered all over the 774 local governments. So when these tertiary university graduates who have already been trained by us go there, they are able to tell them about lifestyle. That's the target. Tell them about lifestyle. How are you going to start now with the journey of lifestyle that will reduce your risk to this disease? This is the disease. These are the outcomes. If you're able to obey some lifestyle, do some lifestyle modifications and have it as a way of life, it can reduce your risk. However, we also pass on to them that if they have like mother, sister, father that has had any of the cancers, they should let their teachers know, and their teachers should tell us so that we target them as a high-risk population. So that's the way we've been doing it. And you'll be surprised, children are the best people to use to pass on information, provided you've done it correctly. That's why we thought it's not a one-off, it has to be a club. Thank you.
So can I just add in there, because I think the word that came out of your talk, and I got from you, so we all did, is this playfulness. That we don't think of cancer and playfulness in the same bracket, but actually, if we really want to engage, we need that lightness. And I think this incredible woman brings it in by the bucket load. What an inspiration. Let's give it up for Pinky Prof.